So do you remember what you thought when you learned about the existence of COVID-19?
Yeah, it was a big day for everybody. And on March 11th, 2020, the World Health Organization declared that disease pandemic. And difficult conversations began soon thereafter at hospitals, especially Gundersen Health System. News 19's Dave Soley spoke with the Bellin and Gundersen Health CEO about, Dave, one of those challenging conversations.
Dustin, it happened as COVID began to spread quickly and cases began to grow. They had to plan for a surge and determine how many patients would their supplies, the remaining supplies, support to help treat people. And if those number of cases grew, how would they determine who would receive that treatment? Dr. Scott Rathgaber says they never had to make that decision. They could treat everyone. He says, however, it was a sobering moment that anyone would ever have to think like that. It was one of many difficult moments during an always challenging time. So we talked about what changed the nature of the virus. He says antibodies and treatments were effective, all of which had to be developed. Medications helped, the vaccine definitely helped. So did masking and physical distancing, and something, he says, not talked about as often.
As viruses continue to cycle in communities, they get less and less virulent, so they get less powerful, because a virus doesn't want to kill its host, its patient, because it wants to spread. And so just the natural progression of having multiple cycles has decreased the severity of the virus while increasing the ease at which we can get it.
And Dr. Rathgaber says fighting the virus was also a community effort, something for which, Dustin, he remains grateful today.
All right, thank you, Dave. Among the remaining questions, are we funding public health infrastructure as well as we can to be prepared for the next emergency? Right now, Dr. Rathgaber says, in his opinion, the answer is no.